The case of today is a patient of 60 years who has severe disease in his prostate. It's an advanced cancer, plurimetastatic. The problem with this patient is that he has also a sclerosis, so he refused any other therapy beside the hormone therapy because he was afraid of the consequences of the disease that he had. So today we will do a prostate cryoablation, a radical prostate cryoablation, meaning that we are going to destroy the whole prostate. We will use a urethral warmer inside the urethra to prevent any possible complications to the urethra, and the procedure will also add to this patient some immunotherapy with immunostimulants and also autologous dendritic cells that will stimulate the immune response that we need absolutely to get to this patient to give him the best chances possible in this case. The procedure is starting now with the insertion of the cryo needles. These cryo needles are thin needles that are inserted in proper location around the prostate, in the prostate. We use 6 probes in this case, 6 needles, together with 3 thermocouples that will be inserted where the cancer is, where it was diagnosed by the previous biopsies demonstrating an advanced cancer. Afterwards, the probes will be activated to generate 6 ice balls that will melt together to cover the whole prostate. Previous of starting the procedure itself, a urethral warmer is inserted. It's a special catheter that will keep the urethra warm, and also a needle is inserted in between the prostate and the rectum that will be used to push away the rectum in order to avoid possible complication to this organ. The probes are activated. 6 ice balls are generated around the 6 cryo probes, and slowly they will melt together, generating a huge single ice ball. The temperature will reach minus 180 degrees at the tip of the probes, and we will check the progression of the therapy, of the procedure, of the ablation, through the screen of the machine that will show us also how the temperatures in the specific points where the cancer is lowering. And we will get very cold temperatures in those spots. The first freezing is stopped. We will wait 15 minutes more or less before starting the second freeze that will give a second hit to the cancer cells in order to destroy them. At the end of the procedure, the 6 cryo probes and the needles are removed. Pressure is exercised over the perineum in order to stop the little bleed that always can happen after the removal of the needles. Now it is the moment to insert the checkpoint inhibitors, these special drugs that will activate the immune system, and we insert them exactly there where it is needed, around and inside the prostate, so that we get the result exactly where it is necessary. At the end of the procedure, we insert also the activated cells of the immune system that were harvested 4 weeks ago and now are inserted there where the antigens released by the cancer destroyed will activate the immune response. So, the case of today was a very interesting case because we had this patient with an advanced cancer, a Gleason 9, 4+5, and a very high PSA that was under hormone ablation therapy but refused absolutely any other therapy because of his sclerosis. So we had to help him somehow, and we provided him this very special treatment that was a radical prostatectomy, plus checkpoint inhibitors, plus autologous dendritic cells. This is a very specific, very advanced therapy that gives us some hope in patients so difficult. And the good thing is that this therapy can be done under local anesthesia with the patient going home just a few hours at the end of the procedure. But in this case, we prefer to give him a spinal anesthesia with no complication, and hopefully tomorrow morning the patient will go home, as all the patient does, and he will have no pain. From this evening same he can eat, and tomorrow starting to have a very fairly normal life. Let's hope that everything goes well.